CEREC, or ceramic reconstruction, is an amazing dental technology that has over 35 million restorations placed worldwide. And in fact, a CEREC restoration is placed every 20 seconds. Dr. Ray Becker is a pioneer in the use of CEREC technology. Joins us now with much more on this. Welcome, Dr. Becker. Glad to have you here.
Pleasure to meet you. Thank you for having me.
This is an exciting area of dental medicine. Tell us how you use the CEREC technology at your practice at Howard County Smiles.
Oh, it's an integral part of everything that we do. With the CEREC technology, we don't have to have any temporaries placed, any impressions are taken. In one visit, we use a camera that takes an image of the tooth, and using advanced computer technology, we can actually create the restoration chairside and mill it right there to deliver to the patient in one sitting.
This is like a one-stop, everything done in one stop, correct? So
Absolutely.
This is like a huge time saver for patients. Talk about the difference in kind of the older method and the newer method in terms of saving time.
Sure. Well, in the old days, when you had a crown, and I say the old days because a lot of dentists still use those technologies to this day, but you would have the patient come in and prepare the tooth and take an impression where you put a tray full of material into the mouth. That would be sent to a laboratory, put in an airplane in a box, sent to a laboratory where a person would create the crown from a die from that impression. So there's a lot of mechanical, physical steps in there, and every single step can incorporate error. The patient goes home with a temporary in their mouth, which may or may not fit or be comfortable, and then the patient has to come back 2 weeks later and hope that that crown that was made by the technician fits. So in this technology, we can use the most advanced materials, and in one sitting, we can actually create the restoration for them, which has impeccable aesthetics, impeccable fit, and it's done in one sitting. It's done in one.
Never have to have that rubber temporary crown. This is like you get diagnosed, you come back for the appointment, and it's done when you walk out.
It's done. And we've done even up to 4 to 5 restorations in an area for when we reconstruct patients. We have some advanced cases where we can rebuild their mouth, and by doing that in one sitting, it saves them a tremendous amount of time. Each visit might take 2 to 3 visits. This takes 1.
Wow. Okay, so a couple of questions may come up with this, with any new technology. So I want to know that any dental work that's done in my mouth has the strength of some maybe the older techniques. Would this be right there with that in terms of strength?
Actually, the studies have shown incredible results. NIH has done studies. There have been different studies from different people around the world. It has a 95% viability rate after a 10-year mark, which is a very, very high number. It's comparable to any other technique. And I believe, truthfully, it surpasses that. We use materials that have no metal, so you have no metal margins. They're zirconia, so they're incredibly strong. Those materials are also very biocompatible, so putting them in the mouth has less likelihood of creating some irritated gums or those dark lines that you see with inflamed gum tissue around the other types of restorations. So the advantages are absolutely huge compared to the old techniques.
No metals involved with this at all?
None. You don't have. Well, you can sometimes mill metal, but most people have gotten completely away from the use of metal in dentistry because of the concerns with heavy metals and contact allergies with women, etc. So it's just a much more advanced technique.
Last point, the cosmetic result, the finished look, is it as good or better than anything else out there?
It lets you have complete control. So not only does the fit exceed what we find from what we get from laboratory-based work, all of that onus is on the dentist delivering the care, so you really can't say, oh, it was the lab. It's got to be, it's you. So I believe it drives you to doing better dentistry because you're creating better crown preparations because you have the design to that restoration, and when you take the image to create the restoration itself. So yes, the aesthetics are impeccable. We're allowed to use and can use materials that have the optimum aesthetics, and we control that process from A to Z with the laboratory equipment that supports it, so it's taking it to a much higher standard.
It's so much to learn on this, but it sounds exciting. If you have an interest in this or just want to find out more, Howard County Smiles, a free consultation there, howardcountysmiles.com, where they can find out more, correct, Doctor?
Absolutely.
All right. Well, thank you for being here so much, Dr. Becker.
My pleasure.
Telling us about CEREC technology.
My pleasure. Thank you very much for having me.
It's a new world, my friend.
It sure is.
We'll be back with more Midday Maryland right after this. Stay tuned.